10 ways to improve your penis.
Love talking about dick.
Will losing weight make someone's penis smaller?
If anything, I would say
Makes it bigger.
it's the opposite.
More intense orgasm and bigger load, like everybody wins.
Exactly.
We want more. Yeah. Hello, my loves, and welcome back to Luvbites by Dr. Tara podcast. Today with us is Dr. Josh, the Hollywood dick doctor.
I'm back.
I'm back, baby.
I'm excited to be here.
Okay, first off, gotta boast a little bit. You're a board-certified urologist. You're a sexual medicine specialist, and you have your own clinic here in West Hollywood.
That's right. Yeah. We're a dying breed, us private practice practitioners.
Yeah,
But
right.
yeah, I specialize mostly in sexual health, so I get to do this every day, all day.
Talk about dick.
I love talking about dick.
And we love having you because last time you were on the show, the episode blew up.
Oh, good.
Yeah.
I mean, we had a really good time.
Yeah, people learned so much from you.
Thank you. That's my goal.
So today you're going to teach us some more.
Oh, okay.
And today it's all about 10 ways to improve your penis.
Ooh, all right.
I like that you go, ooh, as in like you don't have all the answers because you do. But let's get started.
All right.
Okay.
Let's go.
How big is your penis?
8, a little over 8. Are we talking girth or length?
That's not the first question, but thank you for the answer. I kind of predicted that.
Oh, yeah. BDE.
BDE,
Yeah.
big dick energy, for sure. And like how much you spread out. Like you really need room to breathe.
Yeah. You got to give things room to breathe.
I wish that's what I can do. I wish I have like a dick that I can like just have it out to get some air.
Yeah.
Have you ever sunned your balls?
No.
Have you heard of that? People that sun their balls?
Yes. Yeah. I mean, it's a little silly. I try to like always wear sunblock on my face. And the skin on your scrotum and your genitals is usually even more sensitive than the skin on your face. So, I want to keep my boys looking as young as possible. So I'm not taking them out in the sun very often.
So skin on the balls is like even more sensitive than your face?
It's very, very thin. Yeah. So, so you got to be careful.
Well, if you're sunning your balls, you better be putting sunscreen on.
Exactly.
Okay, so the real first question is, what's just the number one thing a man needs to do for penis health?
I would say make sure that you do things that keep the blood flowing down there, right? So the penis is a vascular organ. It obviously needs good, healthy blood flow to get hard and stay hard. As we get older, that becomes more problematic because our cardiovascular system starts to break down over time. So doing things like, getting exercise regularly, sleep is really important. Those things all promote hormone health. Hormone health is super important for erection health. And, just doing everything that your doctor tells you that is good for your heart is going to be good for your penis. So I would say maintaining a healthy amount of blood flow, doing things that are pro-cardiovascular health is going to be the best thing you can do. So
if someone's like, doctor, I've been on a couch for like 3 days scrolling on TikTok. Why is my dick not hard?
I would say put down the phone and get out and go for a walk or a run or do something physical.
Just walk, man. Just stand up, man, at this point.
Yeah, I mean, that's honestly though something that we see a lot, right? You'll see somebody who comes in who is just generally not taking great care of their overall health. They may be a little bit overweight or obese. Maybe they have hypertension, diabetes, and they come in asking like, why can't I get erections anymore? And my first question, or my first response to them is, well, this is just a microcosm of your overall health, right? We need to focus on these other aspects of your health, and your erection and erectile function will get better.
Love that. Erectile function, not dysfunction.
No, we talk about function, not dysfunction.
Okay, this one I get a lot from the internet. So people will like DM me just any wild questions, right? And this is something that I get quite often. So does masturbating too much make the penis less sensitive?
Quick answer is no. I don't think there's anything inherently wrong or bad about masturbation. I think what can happen to some men sometimes is that the way they masturbate can be problematic, meaning men tend to grip harder on their penis and move their hand very quickly when they are masturbating. And sometimes that kind of arousal and friction and movement is not something that they can reproduce with a partner. So a lot of guys will say, you know, I have problems staying hard when I'm with a partner, but I never have a problem when I masturbate.
Or have problems coming.
Exactly, right? So they can't achieve that same degree of arousal with a partner because they're using essentially like a death grip. And you can change that, right? Like a lot of people think, that they're defective or things are hopeless. If you retrain your brain and reteach yourself how to masturbate in a different way in which you can replicate that kind of arousal, then you can fix the problem. So I talk to people about using things like fleshlights or, slowing down. Exactly. Yeah. Trying different things.
Do people get injured like that and come to your office from masturbating?
I haven't seen an injury that I can think of specifically from masturbation, but people do all kinds of like traumatic things to their penis. So you can certainly injure yourself from sex, right? Vigorous sex, partner on top, or even if you're having sex from behind and you go to penetrate and miss, you can
go to penetrate and miss.
Yeah, it's I mean, if you're a guy that's ever experienced that, it's not fun. It hurts, but sometimes it can actually cause a real significant injury. So those are more common than injuries related to masturbation. I've also seen guys who have injured themselves, hanging weights from their penis to try to lengthen it and doing sort of disfiguring kinds of things at home that can
weight on their penis to lengthen it.
Yeah.
Does that work?
No. What it can cause is injury to the nerves and connective tissues in your penis that can make it harder for you to get an erection. So I would not recommend that. Yeah.
Oh, okay. Listen to the doctor, guys. Don't stop pulling on your penis.
Yeah, I know what I'm talking about.
Okay. Number 3, I know that we might have also asked this last time, but it's such a really, really common question that I get. So how can someone have an erection longer?
How can they have an erection longer? Like, are we talking hours?
No, like people say, oh, they have an erection and then they stop having an erection midway, or like how can they make sure that they have the erection throughout the sexual encounter?
Yeah, I mean, I think first of all, you want to make sure that there's nothing serious going on, right? Like if you're consistently having a problem maintaining your erection, you should definitely talk to your doctor about it.
What are some possible causes for that? Is it like heart disease or?
Yeah, so it's usually cardiovascular related. So men can have a condition called venous leak where the blood flow going into their penis is totally normal, but their ability to trap the blood there is not. So the veins, which normally when you're erect are shut off and compressed, they don't allow blood out. In a faulty system, in somebody who has venous leak, those veins remain partially open, and so they literally leak blood out of their penis, and it makes it difficult for them to maintain it.
What?
Yeah. It's something that a lot of guys don't know exists, right? They think like, oh, the blood goes in. If the blood goes in, it's fine. But for an erection to work normally, you get blood in, and then it has to remain there for the period of time that you're having sex. And so guys can have scar tissue in their erectile bodies that can cause problems with leakage. There's just different issues that can come up related to the erectile tissue itself that can cause venous leak. So I would say if someone's having trouble maintaining, you want to rule that out first.
Right, like medical reasons.
Exactly. Yeah. If it's a situational thing, say they're having trouble maintaining their erection when they're with a partner, then I would go back to what we were kind of talking about earlier. What are they doing outside of partnered sex that may be providing a stimulation that's not reproducible with a partner, and trying to adjust that kind of stuff. And then also like take it slow, right? Like don't just go right to jackhammering, right? Like foreplay is super important for maintaining arousal. If you're having sex and you start to lose your erection, maybe go back to having oral sex and then getting hard again and then going back to, to intercourse. So I think just kind of, again, switching up what you're doing to maximally arouse things is going to be helpful.
What about porn? Do you think porn affects their erection lasting longer or shorter?
I think it depends on the person. Okay. So I don't, there's not any clear evidence that porn is detrimental to sexual function. In fact, for a lot of people and in a lot of situations, it can actually be pro-sexual health and make your sex life better. But there are people, I think, that have a problematic relationship to pornography who use it sometimes as a substitute for real intimacy and sexual
and just
relationships.
Rely on that heavily.
Exactly. And so again, if you're training your brain to only be stimulated and aroused by a specific type of imagery or activity that you're seeing, and then you're not, and if that's something that really turns you on and you're not translating that and talking to your partner and saying, hey, I saw this thing in porn that really turns me on. Would you be open to trying it? You know, and you're staying quiet about that kind of stuff, then you've trained your brain to only think of one type of thing as arousing, and then you go to have sex with your partner and that's not happening. And so it's going to be more difficult for you to maintain that level of arousal.
Wow. So don't train your brain to just like one thing.
That's right. That's right.
Variety.
Yeah. Yeah. Or
Baskin Robbins. How many flavors are at Baskin Robbins nowadays?
31.
31? Yeah.
Yeah.
We want 31 flavors.
Yeah. I mean, more flavors the better. But I think
I don't eat dairy, but
they probably have dairy-free kinds now.
At this point.
Yeah. I think, you know, the talking to your partner is a really important aspect of it too.
Yeah.
If you're watching pornography and something is really, you know, turning you on, how do we translate that to real life, right? How do we incorporate your partner into that level of arousal?
Okay, my next question is related to how to improve your penis, okay?
Yeah,
because your penis produces like things.
Yeah.
So
a lot of things. Yeah.
a lot of things,
Yeah.
many things.
Yeah.
But my next question is, how can a man improve his load and maybe even make it taste better?
Yeah, that's a good question. I mean, I get this a lot in my practice about how men can shoot bigger loads. And I would say like the behavioral stuff that you could work on would be to make sure that you're staying well hydrated, because being hydrated is going to make you produce more fluid, right? You want to cut back on things like smoking and alcohol that are going to have a detrimental effect on how things taste. And then, you know,
so if you hook up with someone that like drinks heavily, their cum will not taste good.
That's right. Yeah. Yeah. Or heavy smokers also.
What about vape? Vape too, right?
Yeah.
Because vape is smoking.
Yep. And everything that think of it this way, everything that you ingest has to be excreted somehow, right?
Right.
So, you know, you eat asparagus, your pee smells funny, right?
Right.
The same thing is true for your semen. The things that you're ingesting into your body are going to be excreted, and that includes in your semen.
Are there certain foods that people shouldn't eat because their cum will taste kind of bad?
Yeah, so red meat is a big one. If you eat a lot of red meat, it can have like a not so good taste. But I think focusing more on the things that you should be eating is probably healthier. There's a few ingredients that Popstar has that include things like zinc, L-arginine, pygeum, which have all been shown to increase semen volume. And then you've heard about pineapple. Eating lots of pineapple can make things taste better. Yeah. That's because of an enzyme called bromelain, which is in pineapple that gives a kind of sweet.
And is it
flavor.
In Popstar as well?
It is, yeah.
So talking about Popstar, I want to talk about my very lovely sponsor, Popstar. My husband has been taking this and comes huge loads.
Yes.
Okay, so Popstar Volume and Taste Enhancer actually can help you feel more confident in bed. And sexual confidence is something that I feel everybody wants more of. Right? Like, it's just never enough. I want to feel sexually confident, because that's not only contributing to you feeling good about yourself and your sexual self-esteem, it contributes to your partner feeling good as well, and perhaps find it even more attractive because your load is so huge.
Yeah.
So definitely check out Volume Plus Taste Enhancer. It is created by 2 board-certified urologists. One of them is sitting right here, who is a board-certified urologist. The other one is just a joker.
Yeah,
just kidding.
Exactly.
Just kidding. He's also very established, very impressive man. But basically, when I first heard of Popstar, and I thought, like, that's BS, right? Like, you can't just like take a supplement and like have a bigger load, right? But then again, you know, why would this is not, like gas station brand, right? Like, this is created by 2 board certified doctors, and it has to have scientific reasons and studies. And your website, the brand's website, is so good at sharing those things.
Yeah,
as well.
I mean, we use the brand and the website to educate people about not just ejaculatory health, which is obviously what this is focusing on, but just sexual health in general, right?
Right.
And a lot of it, I'm writing the blogs every time they're posted.
You write your own blogs? That's so cool.
But yeah, I mean, I think the other thing that we should touch on related to like load size, right, is yes, confidence is huge. And I agree with everything you said, but also it makes your orgasm feel more intense, right? So it actually makes sex more pleasurable, right? If you have to expel a larger volume, that's going to require more contractions in your pelvis, and it's going to like prolong the orgasm experience and make it more intense. So we're all about making more awesome orgasms.
More orgasms, more intense orgasm, and bigger load, like everybody wins.
Exactly.
But also you guys came out with new products.
Yeah.
And it's the silicone-based and water-based lube called Play. So if you want to check out Popstar, the link is in my episode description for the volume and taste enhancer, as well as these doctor recommended, doctor approved, doctor made,
Doctor used.
doctor used. Silicone-based and water-based lube. So definitely check out in the link in my episode description. So talking about men's health, what have you been up to?
In men's health or in life?
In life.
What have I been up to? I've honestly just been working a bunch. I've been a year now in my current office space, which is kind of crazy.
It's such a beautiful office.
Thank you.
Yeah.
Thank you. Yeah. I'm glad you got to see it. So I mean, we're just trying to continue to grow and educate people and help people just have better sex. So that's really been my focus is work in the last year.
Well, love that. We love a career man.
Yeah.
Well, this next one is about balls.
Oh, okay.
Because balls, penis, kind of like, episode is about improve your penis. So improve your balls. Is it okay that one testicle hangs lower?
Yeah. Actually, most men have asymmetrical testicles. It's usually not by much, but
what if it's a lot? What if it's like one here, one here?
Yeah, I mean, if it's been their whole life like that, it probably doesn't really mean anything. For instance, men, the testes start intra-abdominal when we're babies, and then slowly descend into the scrotum, right? So men can have undescended testes.
So you pooped out your balls?
Kind of. I guess they're not coming out of your butt, but they. You can have a undescended testicle, either one side or both sides. And sometimes if one side comes down later in
the development.
Exactly. Then you can have some asymmetry. Where I would be concerned is like if they were kind of hanging at the same level and then one is suddenly shorter. Probably doesn't mean anything super serious, but I've seen guys who have pelvic floor dysfunction or pelvic floor tension where one side is getting pulled on more internally and it can cause elevation. And sometimes it can hurt because your balls naturally retract when you're having sex, right? And if one is already kind of starting out a little bit high and it retracts further, it can actually start to go almost inside.
Whoa.
And that can hurt guys.
Whoa.
Yeah.
I've never heard of that before.
Yeah. Yeah.
Like it can go inside?
Yeah. It's not comfortable.
Well, go see your urologist if your balls start changing all of a sudden.
Yeah. And that's like if your balls feel different, if they look different sizes, if anything looks abnormal to you, it's always better to just have someone take a look at it.
Because balls can be very serious.
Yeah. I mean, you can men develop testicular cancer all the time. So, checking your balls, I usually tell my patients like once a month in the shower.
What do you do to check your balls? Just look at it?
So, it's mostly by feel, right? You want to feel that they feel kind of soft and a little bit squishy. Yeah, supple is a good word, actually. And that they don't have any areas that feel hard internally. And then you want to just assess for change. So if you're doing your checks every month and suddenly you go there and one feels much larger than the other out of nowhere, then it's probably worth having someone take a look at it. I'd rather have you come in, me have you checked out, and I tell you everything looks fine than you to ignore something that might be going on.
Fair point.
Yeah.
Okay, my next question is related to weight. So women will say like, oh, I had like such big boobs when I gained weight and then now I lost all my weight. Like I'm more flat chested, right? It's like boobs kind of go with weight.
Yeah.
So will losing weight make someone's penis smaller?
No. So if anything, I would say
makes it bigger.
It's the opposite. So a lot of overweight men.
And can we talk about what is overweight? Because I have no idea. Like, is it like over 200 pounds? Over 500?
It depends on, technically it's by their BMI, right? Which is a calculation based on their height and their weight.
Okay.
So anybody that's falling into an overweight or obese category based on their BMI is going to carry a lot of weight, a lot of fat in their suprapubic area.
Right, like right
the area
here.
right above your dick.
Yeah. The fupa.
The fupa, exactly. So that fupa swallows dicks, right? Penises actually will retract or appear buried in that fat if they carry a lot of fat there. So I would say it's actually the opposite. If you have a man like that who ends up losing weight and losing some fat in his suprapubic area, his penis can actually get bigger. Now, is it really getting bigger? No,
looks bigger.
It looks bigger because it's not being buried in fat anymore. But usually overweight men complain about having smaller penises, and it's because it's being buried in their fat.
Right. So the first thing to do is to weight management.
Exactly. Yeah. And the weight management, losing weight, getting, your blood pressure and under control, if they're pre-diabetic, making sure that they are working on their glucose control. All of those things are going to also help your erectile function. So your dick gets bigger and it gets harder.
Look at that. It's so good for you.
Exactly.
You get all the things.
Yeah.
Do you like vibrators?
Yeah. Personally, or just...
You were going to say you have one on?
Yeah, I'm wearing one right now. No.
Stop. That would be so impressive if you were like,
I was just like,
wearing... Yeah. Okay. I want to talk about my really, really cute, amazing, high quality, affordable price vibrators. These are from Iroha. The first one I want to talk about is Iroha Koharu. Koharu is this small, little, cute, very soft pink vibrator. It's very good for beginners because it's not complicated. And I mean, I have all kinds of sex toys. I have ones that are very complicated with lots of buttons and AI. But then I also have this. Like, it just depends on the day. But if you're a beginner, you've never owned one, for example, or maybe you're buying it as a gift to your girlfriend or partner, I think these are great starter toys. Like, they're the best starter toys. So this is only like $26, by the way, because I know that vibrators can be really expensive and the economy isn't good. But listen to how strong it is. I don't know if you can hear it, but it's so strong. And you can just like twist the bottom and use it. It's like so simple. You want to use it as a microphone.
Do they make penis vibrating products?
Yes, they do. But I only have these 3 little ones.
Yeah, I was going to say, there's like vibrating cock rings and stuff that can be fun for the wearer and also their partner.
Fun. That's true.
You know what I mean? Because then you get vibration on the person
Maybe
who's wearing it, but it also... What's that?
Maybe that's something you should make.
Maybe we should.
Yeah.
Popstar vibrators.
You want to put this lipstick on you? For those of you that, like me, sometimes just want to masturbate when you're at a bar, you can always pull out a lipstick from Iroha. This is the stick. It's called the stick. And just kidding, you can't masturbate in a bar.
Yeah, you could get arrested for that.
Yeah, you can get arrested for that. Please don't do it. But it is super cute, very soft, very durable vibrator. Again, this is such great like starter or maybe like a stocking stuffer gift where you put it in the stuffer. Stuff it in the stuffer.
That's a cute gift. I like that.
And it's $16.
Oh, wow.
Like, it's really high quality for the price. So definitely check it out. And the last one is called the Mini. And the Mini is so cute. And you just have to press one button to turn it on. It's so simple. And it comes in like orange and blue. So for those that don't love pink, because some girls are nowadays, they're like, I hate pink. Mm-hmm. Then you can get orange and blue. Again, these don't have to be just for women. Like anyone can kind of enjoy vibrating things.
I like them because they're also like really inconspicuous. Like you could literally have that on your like shelf at home.
Yes, true. And Iroha has a holiday sale right now with their customizable gift box. So it's just the perfect little gift. It's only $20-something or even $16 for the lipstick. And yeah, definitely check it out. Use my code Luvbites10 for 10% off. The link is in the episode description. So when it comes to toys, are there certain let's say tools, because it's not just toys for play, right? Yeah. Like some of them are like actual tools that improve people's like health and sex life. So are there tools that are great for penises?
Yeah, I mean, I think masturbation tools, things like, I mentioned it earlier, fleshlights or, the various fleshlight-like products that men can use to masturbate, I think can be helpful at helping them retain some sensitivity that they can then reproduce with a partner. Yeah. So I like those. If guys are having trouble maintaining an erection, cock rings can be really helpful.
Because it traps blood in there.
It does, yeah. I always just tell people if you're going to use a cock ring, just make sure it's not metal, because if it gets stuck, you're in big trouble.
People use metal cock ring. Mm-hmm. That's so emo.
Yeah. I mean, it's a large part of like the fetish community. So I'm not like disparaging that practice at all,
Right.
other than to say I've had to cut them off
The penis?
when they get stuck. Not the penis, the cock ring. The cock ring. No, I would never cut a penis off. No. But when the cock ring, if it's metal, gets stuck, you have to saw through it. And you can imagine cutting through metal causes a lot of sparks. So you end up a lot of times burning someone's skin. It's pretty.
And the anxiety.
Yeah, it's pretty traumatic. So
Wow.
if you're going to use cock rings, just make sure they're not metal. But I like talking to patients about cock rings as well. Yeah.
Talking about stuff, one of your videos, or you have like a series about like what I found in a butt.
Yeah. Which happened to be like some of my most popular videos.
'Cause
People are obsessed
curious.
with things stuck in rectums. Yeah.
Yeah, things stuck in rectum. This is the new segment.
Yeah.
So what are some of the things you found in people's butt?
So I haven't always personally found these because as a urologist, I tend to deal with the front area, not
penis and the
so much
balls.
the back
Okay.
area. But people just will stick anything in there. I mean, there's
Like
been
what?
reports
Like
of
a-
light bulbs,
No.
bottles of beer, Coke cans, obviously dildos, vibrators. I mean, anything you can imagine.
I think
It's probably been
in
stuck
one of your
inside.
videos. It's like a toy truck.
Yeah. They found like Buzz Lightyear. Like, I mean, it's pretty remarkable.
Who put Buzz in the butt?
Also, Buzz in the butt. That's going to be the next Toy Story.
That's like
Toy Story 5.
Go.
Buzz
It's
in
like
the butt.
Buzz in the butt. It's for porn. Buzz in the butt goes into your anal.
Yeah, I mean, I just think it's got to be hard to like maneuver that thing in there.
Yeah.
I would imagine that if you want to stick something up your ass, like you'd want it to be kind of smoother so it kind of goes in there easier. But I guess people are very adventurous.
They are. People are adventurous.
Yeah.
So don't try that at home, putting stuff in your butt. Other things that people do regarding health or sports, like sports or gym, are there like certain gym exercises or fad or anything like that that's like not good for your penis? I want to give a backstory. I read this study about bicycle.
Yeah.
About bikes and long distance cyclists
Yeah.
having ED. So is like cycling and ED a thing?
Yeah, I mean, I wouldn't say cycling specifically is like bad for erections.
Right.
Like, if you're doing Soul Cycle on the regular and you enjoy it,
that's
and
like
it's
1 hour.
stress relieving, right? Exactly. And a lot of that class you're probably spending out of the saddle.
Right.
And the problem with cycling is long distance, stationary, seated cycling because the seats themselves can compress the arteries that supply blood to the penis and can compress and injure the nerves that are important for erectile function. So if you're getting a compression injury on those structures, then it can interfere with your ability to get an erection. It's why a lot of cyclists will report genital numbness if they ride for a long time.
Yeah. What about other sports or exercises? All good for the penis?
In general, I mean, you want to not do anything that's going to be traumatic to this area. So, if you're
ball punching, that's not a sport.
I would imagine that like
people should do.
MMA fighting, that kind
That's
of
just
stuff
me.
is probably not going to be great if you're getting kicked or hit in that area a lot.
Oh.
But if you're doing other kinds of sports that are, not direct contact or trauma to that area, I think for the most part, they're pretty safe.
Okay, so this next question, a lot of people are curious about because they want to have like more sensitivity. Are there ways to increase penis sensitivity?
Not any reliable ones. Unfortunately, if you lack sensitivity, it's not something that we can easily get back. It's a challenge because there are men for a variety of reasons. For instance, if they have longstanding diabetes, you can get peripheral neuropathy and they can lose sensitivity or sensation in their penis. It's a problem because we don't have, there are not any medications or any
For
treatments.
penis sensitivity.
Yeah. Now, if you have a known reason for having that, right? Like say you have diabetes and then you get that diabetes well under control over time, people will report a return of sensation.
Right. Okay.
Or if they have, say, like, a herniated disc or something in their spine that's interfering with the nerves to the penis, and that issue is fixed with surgery or something, then sensation can normalize. But it's a tough thing. If someone loses sensitivity, it's hard to get back.
Ooh, what about the cut versus uncut penises? There's a theory that people go, if you're circumcised, which is like a lot of Americans, versus non-circumcised, the non-circumcised people have much more sensitivity in their penis. Is that true?
So that's not really based in any like real data.
So let's put it out there. It's
Yeah.
not like based on science or research.
Exactly. What I will say is that you can have a loss of sensation if you are an adult man who gets circumcised, right? So
Are there a lot of adult men getting circumcision?
I mean, I don't generally do them in my practice unless somebody has a problem with their foreskin. Like if it's too tight or it's tearing or causing recurrent infections, and it doesn't resolve with some medical therapies that we can employ.
It can be too tight.
Yeah, we're if guys, we don't do a good job in this country of teaching boys how to manage their foreskin, and then that translates to adulthood. So if they're not actively retracting their foreskin and cleaning it regularly, it can get tight over time. And as their penis gets bigger, and when they become adolescent and adults, and they say start having sex and they get an erection, if the skin is really tight, it starts pulling, and it can cause them pain when they're having sex. It can tear. It can cause recurrent infections. So we usually try to manage that initially with like some topical medications they can put on there and stretch it over time. But if that doesn't work, then we'll sometimes do circumcision. Yeah, for medical reasons. I'm not a huge fan of doing it for cosmetic reasons because that skin has a lot of nerve endings on there. Men who undergo adult circumcision might report that things don't feel as sensitive when they have sex. But there's no evidence to suggest that neonates, newborns that have newborn circumcisions grow up somehow with less sensation. Like there's no effect on sexual satisfaction in circumcised men versus uncircumcised men if that's done as a newborn.
Period. There you have it. End of discussion.
That's it. I better be careful. People are very passionate about this subject.
They are.
Yeah.
Next question. What can someone do to make their penis look nicer and more desirable?
It's a good question. So, I mean, I would say groom. Maybe start there, right? Like if you got a lot of hair going on.
Like on the legs.
Yeah. Maybe just trim a little bit. I mean, I think we're past the Ken doll waxed look for the most part. I think that's kind of...
Are there people that are completely waxed?
Yeah.
Okay, except porn stars. Because porn stars are completely waxed.
Yeah, but I think that translates to real life too. People see it in porn and they're like, oh, I guess
that's desirable.
That's what I want.
Yeah.
But I would say in my practice, because I see a lot of dicks, that has become less popular than it was, say, like maybe 10 years ago. Okay. So now people are kind of allowing their hair to grow, more naturally, but still kind of trimming it and keeping it cute.
Mm-hmm. Keeping it cute.
So yeah,
cute cock.
Like it's just about hygiene, right? Like shower regularly, keep the hair somewhat trimmed and kempt, right? And then, if you want to make your penis bigger, there are some treatments that can be done to make your dick bigger.
Is that the dick filler?
Yeah.
And it's for girth, right?
It's primarily for girth, but it does help your flaccid dick hang lower. So guys feel more confident when they walk around naked if they're in the locker room.
How long does that last?
So it lasts like 2 to 3 years on average, sometimes even longer. Yeah, it lasts for a while.
Wow, that's way longer than like Botox.
Yeah. And even like lip filler. Like you have to do that more regularly than you do in your penis.
Why is that?
We think it's because the lymphatics in the penis are not as like robust as they are in the face, for instance.
Yeah.
So and lymphatics are what kind of break down the filler over time.
Okay.
And so it just kind of sticks around for longer.
Have you ever heard of dick makeup?
No.
So,
but that sounds like a great idea, actually.
I saw it on TikTok.
Interesting.
I get a lot of information from TikTok.
Little contouring.
But like there's people that like will put some makeup on their penis.
Yeah.
Like when they, for example, when they send like a nude, like when they sext.
Yeah.
Engage in sexting.
Yeah.
They might like put some makeup on their penis.
Yeah.
Like, would you...
I mean, I would say, again, be careful. The skin down there is sometimes a little sensitive.
Is it dangerous or no?
I don't think it's dangerous. I think, if you put something on there and it's irritating to your skin, take it off.
Yeah.
But, I'm not that surprised. I'm sure, people that act in adult films are probably getting touch-ups down there. And it makes a lot of sense given how we like are inundated with imagery all the time on Instagram. People know their angles, people know their lighting, So naturally it would translate down there, right? If you're sending dick pics, you want to make it look cute and big and,
with contour.
And pretty with contouring.
Yeah. With the Kim Kardashian contour.
Yeah. Blend.
When she created it, I wonder if she knew people would be using it for dicks. Okay, the next question is it true that part of your penis is hidden inside your body? And is there any way to bring it out more?
The first answer is yes. So about 50% of your penis is internal.
50% of your penis
Yeah.
is inside
So what
your
you're seeing is
body.
only half the size. So my 8 is actually 16.
Oh, stop.
So the corpora, which is the erectile tissue that gets hard, right? That extends deep into the pelvis and attaches to the pubic bone, essentially.
So like in your pubic, there's more penis.
Yep. Yeah. So internally, there's a bunch of erectile tissue that gets hard.
Gets hard.
Next time you're in bed with your husband,
Yeah.
right? If he's like, let's say, laying on the bed and he gets hard, feel under his balls in the perineum.
Okay.
That area gets erect also. You can
Because
feel.
that's the internal penis.
Exactly. Yeah. So you can actually feel, and that feels good if you're touching that area on a man because
Yes.
it's also sensitive because it's engorged.
I love it. The
Yeah.
taint massage.
Exactly. Exactly. That's why it feels so good to men because that's right where the erectile tissue is.
Oh, that makes so much sense. Thanks for the science,
Yeah.
doc.
Yeah.
What about pulling it out?
Pulling. Oh no. So no.
So that's a
there's-
no.
That's a no. So unfortunately, you just got to live with the 50% you have. Yeah. There's no safe way to pull that erectile tissue out.
We want more. Protest. Okay. I have my last question. Last question is about Kegels.
Okay.
Do you say Kegels or do you say Kegels?
I say Kegel.
Kegels.
Yeah.
Okay. So, there's a lot of information in women's health that Kegels are really good for women. What about men? Like, can Kegels be good for men?
Yeah, I think it depends on the man and what the problem is. So there are a lot of men who have pelvic floor weakness and Kegels.
And like, what does that mean?
So
Like, they pee themselves or?
no, a lot of times it can just be like even maintaining an erection. Sometimes it can be from pelvic floor weakness, or I'll have a lot of patients say that they don't shoot as much as they used to, and it's not a volume issue. Like the amount is not less,
Or
but
they
it like
shoot really
but it
close.
like
Does that mean
dribbles out.
something? Yeah.
Whereas like when
Dribbles.
when they were younger, it would shoot. Right. So that happens because you get contraction of your pelvic muscles. And over time, for lots of reasons, you can just develop weakness in those muscles, like you can weakness in all the muscles in your body. And so Kegels strengthen those muscles, right? And so if you do Kegels correctly, which I would say a lot of people do not, but if you do them correctly, you can strengthen those muscles and sometimes increase your ejaculatory force. You can go back to shooting. The problem is a lot of guys don't really understand what it means to do a Kegel contraction.
Can you talk about it? Like, how would you
Yeah.
describe in layman's term?
In layman's terms, it would be if you're a man and you're peeing, say, at the urinal in the toilet, that muscle that you have to squeeze to cut off your stream.
Yeah.
But the problem is isolating that muscle is difficult for a lot of people to do because there's a lot of muscles in that area. So some guys will squeeze their glutes, which is not really the muscle that you need to be squeezing. So if I suspect someone has pelvic floor weakness, I often will refer them to a pelvic floor physical therapist
Right.
who's better, educated and informed on lots of the complications of these issues, who will teach them how to do Kegels correctly.
And that can help them shoot farther.
Mm-hmm.
That's
And
so-
sometimes make it easier
that's
for
so
them
interesting.
to stay hard too.
Wow. Okay, what are other tips that comes to your mind regarding improving the penis or helping the penis look more attractive?
First of all, I would say be in love with your penis, no matter what it looks like, right? Like
Such a wholesome advice.
No, I mean it's your body, and the reality is I do penis filler in my office, right? Most men who are coming in for this procedure have completely normal sized penises.
Oh.
They, for whatever reason, have some insecurity about it. Maybe a partner said something one time. Maybe they walk around in a locker room and see other guys' dicks and feel insecure. So for whatever reason, they opt to do this treatment.
Right. Well,
and they're
it's like women. Like women can look beautiful naturally, but some women love getting Botox, and that's fine. It's like people's prerogative.
The analogy I give a lot of times with women is breast implants, right?
Right.
Most women who are getting breast implants have
Right.
normal size breasts,
Yes.
right? And good looking breasts.
Right.
But for whatever reason have an insecurity about the size.
Yeah.
And you know what? They get breast implants and many times feel more confident.
Right.
And love to show them off and their partners love it. And the same thing is true for something like penis filler. So, I would say starting with just like loving yourself and your body as it is. If there is something that you're insecure about, do some research. Don't elect to do things that might be unsafe.
Yeah,
No hanging
like
weights
at
from your
home-
dick.
At
No,
home dick fillers.
yeah, don't go to back alleys, or TJ and get silicone injected in there. Go to a professional who knows what they're doing.
Go to the Hollywood dick doctor, Dr. Josh. Come over to West Hollywood.
Come to my place. So yeah, I mean, I think trying to educate yourself on what is normal, learning to love yourself, and if you want to do some sort of enhancement, going to someone who's reputable, who knows the penis anatomy, and who knows what they're doing.
Love that. Where can everyone find you?
On Instagram, TikTok, at Joshua Gonzalez MD. My website, joshuagonzalezmd.com, is also full of like a bunch of resources about all things sexual health. And then Popstar Labs is where you can learn about the volume and taste supplements, our new line of lubes. We've got some exciting stuff in the pipeline.
There's also the fertility one.
Yeah, right. That's right. We have a fertility supplement. And we've got a couple tricks up our sleeve for 2025 and beyond. So,
any holiday season thing coming up?
Nothing that's going to be released before the end of the year. But we do have some Black Friday deals that people should definitely take advantage of. And then, just keep an eye out for us in 2025 because we have some products that are coming out.
Awesome. We're going to have you come back.
I love it. I would love to.
Believe it or not, there are more questions about the penis that I can ask.
There's always questions about penis. I wouldn't have a practice if that wasn't the case.
So far we have done 2 episodes with Dr. Josh. So I have asked more than 20 penis-related questions thus far.
Yeah.
But there's more.
There's always more.
So next season.
Perfect.
Yeah. Thank you so much for joining us.
Thanks for having me.
Yay, and my loves, thank you for listening and watching till the end of the episode. I am wishing you multiple orgasms because you do so. Please like, subscribe, comment, and share because it helps this show grow and it helps spread sex positivity, which so much more people need. So definitely share this episode, and per usual, have an orgasmic day. Bye!
Thanks for listening. This was Love Bites.
Love Bites.
By Dr. Tara. Follow Dr. Tara on social media at lovebites.co. Have an orgasmic day.